Hi
Okay.
everyone, my name is Megan,
Hi, I'm Alicia.
and our topic is about opioid use and how it affects pregnancy. So, starting off, our target population is pregnant women. Our topic is on substance abuse and more specifically opioid use and how it affects pregnant women. Ways that opioid use affects pregnant women and their fetus is that it can cause possible preterm birth, stillbirth, maternal mortality, and neonatal abstinence syndrome. This is a condition that is caused when a baby has withdrawals from certain drugs it's been exposed to in the womb before birth.
Okay, so for the Healthy People 2030 objective, the one that we found that was closest to our topic was increased abstinence from illicit drugs among pregnant women. And this data was collected from 2017 to 2018. So as a baseline, around this time, 93% of pregnant women ages 15 to 44 abstained from illicit drugs in the past 30 days. The target was to reach 95.3%, and the most recent data from 2018 was 94.4%. So there's still an increase that is desired. So according to the CDC, between 2010 to 2017, there was a 131% increase in opioid-related diseases or diagnoses among pregnant women, and this is referred to as opioid use disorder. Furthermore, out of these pregnant women, 7% reported using prescription opioids for pain relief, and 1 in 5 of those reported misusing opioids. The CDC defines misuse as getting prescription opioid pain relievers from a source other than a healthcare provider or using them for a reason other than to relieve pain. So, as mentioned before, a prenatal opioid use has severe consequences on both the mother and the child, including increased risk of maternal death, preterm birth and stillbirth, and birth defects, especially neonatal opioid withdrawal symptom.
So for the data, we found it was on opioid misuse around pregnant women ages 15 to 44 from 2007 to 2012. This chart shows the percentage of pregnant and non-pregnant women who have used opioids. We can see that in the younger pregnant women, opioid misuse is much more common. And then the chart on the right is on opioid misuse amount around the same age group, 15 to 44, but this is on the pregnancy status and federal poverty level. Again, this chart shows the percentage of pregnant and non-pregnant women that are below federal poverty level and at or above federal poverty level. For this chart, pregnant women who fall below the poverty level have a higher percentage of opioid misuse.
Okay, so um, opioid use disorder among pregnant women has several disparities. Um, Overall, 55% of pregnant and or postpartum women receive medication to treat OUD. So there's a clear disparity there. And this is better seen if we look at different socioeconomical factors and demographics. For example, white women had a 5.5% OUD documentation rate, and in comparison, Black women only had a 1.1% documentation rate. And this could be caused by many different factors. For example, unequal access to prenatal care, physician bias, and also increased stigma among Black women for admitting drug use due to cultural factors. Also, age is a big disparity as older women from either 26 to 34 or even 35 plus had a much higher documentation rate in comparison to younger women who only had a 1.6% documentation rate. And finally, there are also disparities in OUD treatment in different states. So, for example, in Maine, they had the highest treatment rate of 79%, and Kansas has the lowest treatment rate at 19%. And the main cause for this is how Medicaid is enforced differently across states. Like, for example, some states may be more strict about prior authorization and have other requirements like mandatory counseling and random drug screenings. And this could all impact a woman's ability to get treatment for OUD.
So now we have some root causes on opioid use. Firstly, is that it's gotten increasingly worse in the United States. The total number of opioid prescriptions has increased from 670,000 to 6.2 million from 1997 to 2002, which is a total increase of 45 million. According to some studies, 80% of opioid abusers started with a prescription before they became addicted. And pharmaceutical insurance companies, medical governing agencies, and pharmacies had good intentions in improving patient care and trying to decrease the cost. However, this indirectly contributed in the opioid crisis. As for opioid prevention, the CDC provides information on their website for creating a treatment plan for pregnant women with opioid use disorder. The treatment plan can be used either before, during, or after pregnancy. Some protective factors when it comes to opioid use is positive connections, family support, friends, community, culture or religion, and strong coping and problem solving skills, which are all very important. Overall, just surrounding yourself with people who are a positive influence in your life.
All right, so here are two examples of different programs that aim to address the opioid crisis among pregnant women. The first example is the Indiana Pregnancy Promise Program, and this is a governmental program with a mission to provide prenatal and postpartum care, mental and physical health care, and even treat OUD. The eligibility to be a part of this program is that you have to be an Indiana resident. You have to be currently pregnant or have been pregnant within 90 days and have current or previous experience with opioid use, and you have to be eligible for Medicaid coverage. The second example is the Texas Health and Human Services, and this is another state or governmental program. And their mission statement is that they provide hundreds of programs and services that help 7.5 million Texans a month to live better lives, and that they have a strong foundation of dedicated people who make this mission happen every day. Their vision is to make a positive difference in the lives of the people they serve, including women who have opioid use disorder. And to be eligible for this program, you must be a pregnant woman in Texas who is covered by Medicaid. And that is all for our presentation. Thank you.
Thank you.
Here's some of our references as well.